Hello, my name is Vicky. I'm a physiotherapist for the Somerset NHS Foundation Trust. I want to talk about carpal tunnel syndrome. I'm going to explain about the condition, the symptoms you might experience, some suggestions on how you might relieve these symptoms, and some simple exercises. Carpal tunnel syndrome is a condition caused by the median nerve being compressed as it passes through the carpal tunnel in the wrist. The carpal tunnel is formed by the wrist bones and a thick ligament. It contains 9 tendons as well as the median nerve. Any condition that reduces the amount of space within the carpal tunnel can cause carpal tunnel syndrome, such as inflammation or fluid retention. Some activities may also contribute to carpal tunnel syndrome. For example, repetitive gripping, using vibratory tools, or computer work. Carpal tunnel syndrome commonly affects middle-aged women, but can occur at any age for both women and men. The dominant hand is most commonly affected. Carpal tunnel syndrome can cause a variety of symptoms, including pain, tingling, numbness, swelling, weakness or clumsiness of the thumb, index, middle or ring fingers. People often tell us that the symptoms are worse overnight or first thing in the morning. They are often not present during the day, but gripping activities such as driving or holding a telephone may aggravate your symptoms after a time. You may notice that your grip becomes weaker, causing you to drop things, and some people find that fine finger movements like doing up buttons become more difficult. There are a few strategies that might help you reduce or prevent the symptoms of carpal tunnel syndrome. The first thing you might like to consider is reducing the duration, frequency or force required to complete tasks. For example, take regular breaks during heavier or repetitive tasks, or consider alternative ways to perform a task. Avoiding holding your wrist in prolonged extremes of movement can be helpful. At night, a wrist splint can be worn to keep your wrist in a neutral position while sleeping. It should be removed during the day and never worn when driving. It can be helpful to avoid prolonged or repetitive pinching or gripping movements by loosening your grip or changing hand position regularly. Consider reviewing your environment, ensuring your workstation setup is suitable for you. Monitor your posture and working positions. Use tools with thicker handles as this requires less force to hold. The following exercises can help relieve carpal tunnel syndrome symptoms by gently gliding the median nerve and tendons through the carpal tunnel.
Hold your arm out to the side with your palm facing up and wrist bent back. Straighten the elbow and hand 3/4 of the way. Alternate these positions. Repeat 5 times. Bend your wrist down, flexion, with your fingers straight. Then back, extension, with your fingers in a bent position. Keep your fingers relaxed, not in a tight fist. Keep your elbow still while you do the exercises. Repeat 5 times. Start with your wrist and fingers straight. Hook your fingers, keeping the knuckles straight. Bend at the knuckles, making a closed fist. Straighten the fingers, keeping the knuckles bent. Bend your fingers, placing your fingertips on the base of the palm. Repeat 5 times. Wearing wrist splints while you are sleeping may reduce the severity of symptoms. Splints help to reduce symptoms by positioning the wrist where the carpal tunnel is most open and allowing inflamed areas within the wrist to rest. It should be comfortable and supportive, but not excessively tight. If you experience new or worsening symptoms, stop using the splint or brace. Check for redness, blisters, or breaks in the skin under the brace. Your physiotherapist will provide you with a splint and show you how to fit it appropriately. If symptoms persist, your physiotherapist might discuss further treatment options with you, which may include corticosteroid injection or a small operation to release the median nerve. Please note that after you start using the splints, it may take several weeks before you start to notice an improvement in your symptoms.
We hope you have found this information helpful. Your physiotherapist or GP can help you with any further advice or guidance and answer any questions you may have. Thank you for watching.